From surgically modified bodies to becoming a millionaire in a day business, do we even know what's real anymore? Every day we are faced with the next best thing when we're just trying to become healthier, wealthier, and happy. What the fuck is real? What the fuck is true? What the fuck are you supposed to believe about yourself and your success while trying to build something that actually lasts? Welcome to What the Fuck is Beauty Anyway, the podcast. I am your host, Jen Carrasco, founder of Raga Studio, a fitness champion, IFBB pro figure competitor, a skincare line creator, and a serial entrepreneur. Well, and I'm an overall business coach. After years of building businesses from the ground up, I am here to help you with society's standards and, well, to use your beauty within to build something that is truly you and truly impactful. So now let's dive in. What is going on, guys? So today we are actually going to dive back deep into skincare. So there's a couple questions that I've been getting lately, and actually I've been noticing it a lot in my clinic lately. And I don't know if it has to do with the weather, which per se usually, as we call this type of acne, which isn't really a form of acne, we tend to get it more in the humid, hotter, atmospheres that we live in. So today I wanted to talk about the AKA that they call fungal acne. Now, this is an acne that shouldn't be called an acne, but it is because it does tend to look like a type of acne that you have on your skin. A lot of people resonate this with folliculitis. And folliculitis is a bacterial overgrowth that is in your sebaceous gland, which is your oil gland that is connected to your hair follicle. So it's pretty much in your hair follicle is this bacteria. Now, this fungus acne, which we call folliculitis, is it's an actual yeast overgrowth in the skin. Now, the reason why I really wanted to go over this is because I see a lot of people that have been doing a lot of antibiotics and things like that. And unfortunately for women, we tend to probably more likely get the yeast infections after we get off of antibiotics. But what I'm noticing with people lately and my clients is that they're actually getting this type of fungal acne, which is actually just a yeast overgrowth in their hair follicles, pretty much. And that can contribute to getting off any type of antibiotic that you are on. So today I'm going to kind of go over what the fungal acne is, what we can do to treat the fungal acne, and kind of dive in deep. And then on my social media platforms, I am going to post some pictures when this launches. And that way you guys can see exactly what fungal acne is, because it definitely has a specific look to it. And honestly, a lot of estheticians that are not trained properly, they're going to treat this as acne, which I have to say that you can get acne with this in combination. So it's not that you cannot get both. Sometimes you do have both. But there are ways to treat this. And unfortunately, if you cannot treat it in clinic or at home, you definitely have to see a dermatologist to get, a superficial ointment to put on there to kill some of the fungus. So a fungal acne, in the buzz term, as we say in the beauty world, is a fungal acne. But honestly, what it is it is actually a yeast overgrowth in your hair follicle. So acne cannot be caused by a fungus. So know this, just the very term fungal acne is a contradiction to the term because of acne is defined as a chronic condition caused by genetic dysfunction, and a hyperkeratosis. So a disease that causes an overproduction of skin cells to get backed up in the follicle, which then creates these little acne seeds called microcomedones. And those are our little acnes. These seeds then grow like a flower due to a number of internal and external factors like diet, products, bacteria triggers. If the seed, as we know, is the microcomedones, if the seed is big enough or ruptures the follicle wall, inflammation sets in, but inflammation is just a symptom of acne. So this is something that I actually dive in deep with my clients in the clinic for years. So I've been dealing with acne for over 21 years, and I have seen some amazing results. And unfortunately, I have seen some cases that definitely have to go in the route of, taking some internal medicine because I could not treat it. So let's go on about what a fungal acne, or what is a fungal acne. So an accurate term for a fungal acne, again, like we talked about, is a folliculitis, and both occur in the hair follicle. But unlike acne, which is caused primarily by overgrowth of dead skin cells, this is caused by overgrowth of yeast in our hair follicles. So I'm trying not to throw out too big of words. I have my list of all my words, but I don't throw that out because you guys are not going to understand. So I'm going to kind of go in layman's terms. So we actually all have yeast and bacteria all over our skin and inside our body, and it serves as an important function, but it develops when this particular fungus, number of potential reasons that it overgrows is that your good bacteria is actually, not prominent in that place, and it causes an imbalance. And similar to acne, prolonged heat, moisture caused by exclusive clothing like tight, sweaty exercise clothes, they can cause the yeast overgrowth. So a lot of times I see this type of acne, which is the fungal acne. I typically see this on the back and the chest or around the hairline. Now, I guess I tend to see it a little bit more with my clients because my clients tend to be more active clients. They're more working out, physical, and unfortunately with those type of clients, we tend to sweat a lot and we perspire a lot, which actually gets that imbalance to happen within our skin a lot. A quick little thing that I want to say out there to a lot of my clients and a lot of people listening is that when you are someone that definitely works out a lot and you're really physical, when you're done with your workout, I do not recommend a balancer that's going to strip your lipids. Now it's called a Hydro Balance, and it's a little bit pH higher than your normal skin type. So it is going to hydrate you, but it has antibacterial qualities in the spray. So my suggestion is that when you get done with a workout and you tend to break out or you tend to get like a fungal acne, is that you spray your face down or the areas down that you tend to get those right after your workout. So at least what it's going to do is go in and help to kill any bacteria that could be sitting on the surface of the skin, or it can balance your skin back out to where it needs to be so your tissues are healthy and balanced. Just like I said before in one of my last podcasts, is that your skin's pH has to be balanced at all times to have proper natural skin that does not get breakouts or inflamed or dry. It has to be at a proper pH for your body. So why do they call it a fungal acne if it's not actual an acne? So two words I have to say are ignorance and confusion. So even the most highly paid beauty bloggers and influencers out there, let me tell you, a lot of them don't know what the hell they're talking about. So just take that from my word. They're freaking ignorant about acne, and they just refer to any type of bump on the skin as an acne. They are not qualified. They have not been in the skin industry for a long period of time to exactly know what's going on. They are beauty bloggers. They look at products that are on the market. They try it at home, but they don't actually have clients in their clinic. They're not working day in and day out with people. So honestly, food for thought for you guys. Stop listening to all their BS and their bullshit and their media marketing, because all they're doing is making money off of you. So let's go back. It is also easy to confuse the two because there are 7 different types of acne. And one type of acne, non-inflamed acne, looks similar to the folliculitis because they both look like small bumps under the skin. This is a tricky type of acne. The most people don't identify acne because it is not big or red or inflamed. A lot of people don't even refer to it as acne. They refer to it as texture. And I have even had some clients who have been mistakenly told by their dermatologist that is an allergic reaction. If the skin doctors have trouble discerning the different types of bumps on our skin, this is no wonder there is so much garbage and information out there. This is the one reason why I created What the Fuck is Beauty Anyway, because I feel like even on a dermatologist level, a lot of people are not highly educated on skin. And you really have to know who you're listening to know exactly if they're BSing you or if they're actually honestly truthful with, how do I say, their skin facts, right? So how do I know if it's an fungus or an acne? So a fungus or a fungal infection like this one can look very similar to a non-inflamed acne. It can be hard to tell the difference. The only way to know for sure if you have this fungal acne is to have it checked out and examined under a microscope by a doctor. But there are also some huge hints. Does it itch? Acne doesn't typically itch, but this form of acne does. The only time you will have itchy acne if you have inflamed acne lesions, but that the kind of itching is typically mild and doesn't last very long. And if it is an inflamed acne, it will be swollen, red, and maybe full of pus. So it will look very different from small uniform bumps that characterize this type of acne, or fungal infection, I should say. So it almost looks like you have a texture issue on your skin. You have all these little tiny bumps, and a lot of times they don't come to a head. And sometimes clients or estheticians or dermatologists will say that it is, a type of like a irritation to a product, but it necessarily is not that. But I'm going to dive in deep too on products that you need to be avoiding if you have a tendency to get this type of fungal acne. So the pattern of the fungal acne is the bumps tend to appear in clusters and they're uniform in size, whereas acne tends to be randomly distributed and appears in the various sizes. So normal acne, you're not going to have a cluster of them everywhere. It's going to be randomly kind of all over the skin. So is there a core or a head on this type of acne? All type of acne start with a little seed. So you always have a little seed underneath the skin, and that is called a microcomedone. That is made up of mostly dead skin cells. So out of all of the 7 types of acne, you'll have a grain-like seed inside of it or on the surface of the skin. Like I said before, this type of acne does not have a head in it. If you dig in deep, you can probably get out some oil production out of it. But honestly, you're going to do more damage trying to dig in deep into this acne. So leave it alone. Let's go over. Forehead bumps are usually caused by this. So I typically do get it, and I get it around my hairline and my temples. So lots of bloggers and influencers who talk about fungal acne claim that it usually appears on the forehead. It's not necessarily the case. Even though I tend to get it there, a lot of people will get it on their chest and they will get it on their back. So it actually is more common on the body than it is on the face, like I talked about. It's more likely that your forehead bumps are caused by retention, hyperkeratosis, and is triggered by comedogenic hair products, which is typical. But I see a lot of clients that are definitely athletes that don't really wear hair products and they pull their hair back a lot. And they do have this, and I can tell it's triggered by this type of fungal. So I say triggered by acne, regardless of what type or where it is located, is always of the pore clogging ingredients that you have recently gone to the hairstylist or gotten your hair blown out and they use a comedogenic product in your hair. You are likely breaking out from that. You have a whole Pinterest board that will tell you of all the product recommendations that will definitely be breaking out your forehead. So let's talk about treatments for this type of acne. Now, in my clinic, I do something different. I'm going to give you something that you can do kind of, at home if you don't have it, but you can always go onto my website. It's called vskincareline.com. V is in Victor, skincareline.com. Now, I created a product and it is called Recovery. Recovery is an amazing epidermal growth product. What that does is it will actually create almost like a sealant on the top of the skin to heal up the top layer of the skin, and then it starts to dive in deep. And it has an oxygen in there. And so the oxygen is going to push in more of that healing properties, and it's going to kill a lot of that bacteria that's underneath. Now, you need to do this coincide with a couple other products. So my recommendation for you is to get some Selsun Blue or an antifungal wash. And a lot of those are like shampoo washes is what they have. You want to wash your body or your face with that and leave it on for a good 2 to 5 minutes and let it soak in. Now, the downside to using these products is I always say do not use this stuff on your face because it's bad for your skin tissues. It is, but you have to kill the fungal bacteria and it's the only way to do it. So leave it on there. What you're going to notice is over a period of time, you might have your skin tissues dry out a little bit and then back off of it a little bit until your skin gets back and acclimated to what it needs to. But there's alternative things that you can do. So what I have my clients do is I have them use a Selsun Blue and I have them wash their face morning and night and leave it on anywhere from 1 to 5 minutes to soak in to kill some of that bacteria. Now, when they get out of the shower, I do not have them wash or to dry their face. I have them actually directly spray the hydro balance on their skin to balance their pH back to level again. So that way there's no imbalances in the skin. After that is done, in the morning, I have them do their regular routine of putting their makeup on and things like that. You want to avoid any heavy creams, any lotions, anything like that. That is going to go in and help to clog that follicle again. It's going to actually create more of an imbalance and it can actually create more of a yeast production in those areas. So the last thing you want to do is be sticking on something that is going to be covering the skin as a glue-like symptom because then your skin cannot breathe. So I highly recommend the Hydro Balance. It will hydrate your skin without any moisture. Then my clients at nighttime, I have them do the Selsun Blue again. Then I have them directly do the Hydro Balance again after the shower, and then they put on the Recovery. Now the Recovery, I have them directly put that onto their face. I have them do this for about 5 to 7 days. Then I start to have them back off of the Selsun Blue and the Recovery, and I have them only do it about 3 times a week. And then the following week, you're going to do it 2 times a week. And then the week after that, you're going to keep it and maintain it for 1 time a week, as long as you tend to get this fungal growth. So the reason why I have that is because that is your alternative. That is your medicine to do at home to keep it at bay to where it doesn't form. So, lifestyle adjustments that I want to go over: avoid saunas, sun exposure, and steaming. Always wear loose fit clothing, change sweaty workout clothes right away, and showering immediately after exercise. The antifungal shampoo or body wash, like I talked about, is the Selsun Blue. You can also use a prescription topical cream. And then if this does not go away, you need to go and get an oral antifungal medicine. Now, let me know. I do free consultations. I have my girls that work with me and myself as well. We do consultations and we will look at your skin and we'll go over things if you feel like you want a little bit more help into depth with it. So that is my spiel today. I really wanted to go over it. I'm sure that this will actually be a great podcast for a lot of people because I do feel like for some reason right now it has been popping up a lot lately. So with that, make this week a fabulous week, you guys, and I will talk to you next week. Thanks for turning in this week. I hope that you thoroughly enjoyed this episode, and I hope you're feeling stronger mentally and physically and ready to kick some ass. As we navigate new society norms, business and beauty breakthroughs, make sure to always ask yourself, what the fuck is beauty to me? And know that's all that really matters. If you love this content today, make sure to subscribe, rate, and review. Follow me and get more info on how to work with me at jencarrasco.com. You can also find me on all of your favorite social media platforms. Now just remember, stay mentally tough.